Many people think of snoring as a harmless annoyance. It is often the subject of jokes within families or between partners. But in reality, loud and persistent snoring may be a warning signal from the body. Snoring occurs when airflow through the upper airway becomes partially obstructed during sleep. As air passes through narrowed passages in the throat, the surrounding tissues vibrate. This vibration creates the sound we recognize as snoring. Occasional snoring can happen to almost anyone. It may occur after alcohol consumption, when sleeping on the back, or during temporary nasal congestion. However, when snoring becomes loud, frequent, and accompanied by breathing pauses, it may indicate a more serious condition known as obstructive sleep apnea. Sleep apnea is a disorder in which breathing repeatedly stops and starts during sleep. These pauses may last several seconds or even longer. During each pause, oxygen levels in the blood begin to drop. The brain senses the lack of oxygen and briefly wakes the body in order to restart breathing. Most people with sleep apnea are unaware that these awakenings occur. They may wake up in the morning believing they slept through the night, even though their sleep was repeatedly interrupted. These interruptions fragment sleep and prevent the body from entering deeper restorative sleep stages. But the effects go far beyond fatigue. Every time breathing stops, the cardiovascular system experiences stress. Oxygen levels fall, blood pressure rises, and the heart must work harder to compensate. Over the course of a single night, these events may happen dozens or even hundreds of times. Imagine repeatedly holding your breath and forcing your heart to restart normal oxygen circulation again and again. Over months and years, this repeated stress may damage the heart and blood vessels. This is why sleep apnea is now recognized as an important risk factor for hypertension, heart disease, and stroke. The danger is that many people remain unaware of the condition. They may notice snoring, morning headaches, or daytime fatigue, but they do not connect these symptoms with cardiovascular health. Understanding the connection between snoring and sleep apnea is the first step toward recognizing a hidden threat that develops quietly during sleep. To understand why sleep apnea is dangerous for the heart, we need to look at what happens inside the body during an apnea episode. When breathing stops, oxygen levels in the blood begin to decrease. At the same time, carbon dioxide levels rise. The brain detects this imbalance and activates an emergency response. This response triggers the sympathetic nervous system, the same system that activates during stress or danger. Adrenaline is released, heart rate increases, blood vessels constrict, blood pressure rises. These changes are meant to restore breathing quickly. However, when apnea occurs repeatedly during the night, the cardiovascular system is exposed to repeated cycles of oxygen deprivation and stress activation. This pattern creates several harmful effects. First, blood pressure begins to rise not only during sleep but also during the daytime. Many people with sleep apnea develop hypertension that becomes difficult to control. Second, oxygen deprivation damages the lining of blood vessels. The inner lining of arteries, known as the endothelium, plays a key role in maintaining healthy circulation. When oxygen levels fluctuate repeatedly, endothelial function may deteriorate. This process contributes to inflammation and promotes the development of atherosclerosis, the buildup of plaque inside arteries. Third, the heart muscle itself experiences increased workload. Each time oxygen levels fall, the heart must pump harder to maintain circulation. Over time, this repeated strain may contribute to enlargement of the heart muscle and reduced cardiac efficiency. Sleep apnea is also strongly associated with abnormal heart rhythms. Irregular heartbeats, including atrial fibrillation, occur more frequently in individuals with untreated sleep apnea. These rhythm disturbances can further increase the risk of stroke. Another major effect is poor sleep quality. Because the brain repeatedly wakes the body to restore breathing, deep sleep stages are disrupted. As a result, people with sleep apnea often wake up feeling exhausted even after many hours in bed. This fatigue may contribute to decreased concentration, mood changes, and reduced overall quality of life. But perhaps the most concerning aspect of sleep apnea is that many people live with it for years without diagnosis. The symptoms may appear mild, but the cardiovascular consequences develop silently over time. One of the biggest problems with sleep apnea is that many people live with it for years without realizing what is happening during the night. Because the breathing interruptions occur while a person is asleep, the symptoms are often noticed by a partner or family member rather than by the person experiencing them. The most common warning sign is loud, persistent snoring. This type of snoring is usually deeper and more irregular than occasional snoring caused by a cold or temporary congestion. It may include choking sounds, gasping, or sudden pauses followed by a loud breath. These pauses in breathing are a key sign of obstructive sleep apnea. Another common symptom is waking up suddenly during the night feeling like you need to catch your breath. Some people describe it as a sensation of choking or suffocation. Morning symptoms can also provide clues. Many individuals with sleep apnea wake up with headaches. These headaches are often caused by repeated drops in oxygen levels during sleep. Low oxygen affects blood vessels in the brain and may lead to pressure sensations after waking. Dry mouth or sore throat in the morning is another common symptom. During apnea episodes, people often breathe through their mouths, which dries the airway tissues. Daytime fatigue is one of the most noticeable effects. Even if a person sleeps for 7 or 8 hours, sleep apnea prevents the body from reaching the deep restorative sleep stages necessary for full recovery. As a result, people often feel tired throughout the day. They may struggle to concentrate, experience memory difficulties, or feel unusually irritable. Excessive daytime sleepiness can become dangerous in certain situations, such as driving or operating machinery. Some people also experience mood changes, including anxiety or depression due to chronic sleep disruption. Another overlooked symptom is nighttime sweating. The repeated stress responses triggered by apnea episodes activate the nervous system and may lead to increased perspiration during sleep. High blood pressure that is difficult to control is also frequently associated with sleep apnea. Because the body experiences repeated stress responses at night, blood pressure regulation becomes disrupted. The important point is that these symptoms often develop gradually. Many people assume they are simply tired or stressed, without realizing that their breathing repeatedly stops during sleep. Sleep apnea does not only affect breathing, it has a powerful impact on the cardiovascular system. During an apnea episode, the airway collapses and airflow stops. The chest continues trying to breathe, but air cannot pass through the blocked airway. This creates negative pressure inside the chest. At the same time, oxygen levels fall, and carbon dioxide levels rise. The body reacts immediately by activating emergency stress signals. Blood pressure rises sharply. Heart rate may fluctuate. Blood vessels constrict. When this happens occasionally, the body can recover quickly. But when apnea occurs dozens or even hundreds of times every night, the cardiovascular system experiences constant stress. Over time, this repeated stress may contribute to several heart conditions. One of the most common consequences is hypertension. Studies show that sleep apnea is strongly associated with high blood pressure, particularly morning hypertension. Another serious risk is coronary artery disease. Repeated oxygen deprivation promotes inflammation and oxidative stress inside blood vessels. These processes accelerate the formation of plaque inside arteries. Sleep apnea is also closely connected with heart rhythm disorders. Atrial fibrillation, one of the most common abnormal heart rhythms, occurs significantly more often in people with untreated sleep apnea. The reason is that repeated oxygen fluctuations affect the electrical stability of heart cells. Heart failure may also develop or worsen in patients with severe sleep apnea. The heart must work harder to maintain circulation during repeated oxygen drops. Over time, this strain may weaken the heart muscle. Sleep apnea also increases the risk of stroke. When oxygen levels repeatedly fall, blood vessels in the brain experience stress and inflammation. This increases the likelihood of clot formation and vascular damage. Because these changes develop slowly, many people underestimate the long-term impact of sleep apnea. But untreated sleep apnea is now considered one of the important modifiable risk factors for cardiovascular disease. Sleep apnea can affect people of many ages and backgrounds, but certain factors significantly increase the risk. One of the strongest risk factors is excess body weight. Fat deposits around the neck and throat can narrow the airway and increase the likelihood that it will collapse during sleep. Neck circumference is often an important indicator. Individuals with thicker necks tend to have higher risk because airway structures become more compressed during sleep. Age is another factor. As people get older, muscle tone in the throat may decrease. This makes airway collapse more likely. Men are generally diagnosed with sleep apnea more frequently than women, although the condition occurs in both sexes. Hormonal differences and airway anatomy may contribute to this pattern. However, after menopause, the risk for women increases significantly. Alcohol consumption before sleep can also worsen apnea episodes. Alcohol relaxes throat muscles and makes airway collapse more likely. Certain medications that relax muscles or suppress breathing may have similar effects. Smoking is another contributor. Smoking irritates airway tissues and increases inflammation, which narrows breathing passages. Genetics may also influence risk. Some people naturally have airway structures that are narrower or more prone to collapse during sleep. Even facial bone structure can influence airflow during sleep. Finally, nasal congestion or chronic sinus problems may increase resistance in the airway, contributing to snoring and breathing interruptions. Understanding these risk factors helps identify individuals who may benefit from sleep evaluation. Sleep apnea is more common than many people realize, and awareness is an important step toward prevention and treatment. The encouraging news is that sleep apnea is a condition that can be identified and managed once it is recognized. Diagnosis usually begins with awareness of symptoms. Loud snoring, breathing pauses, morning headaches, and persistent daytime fatigue often lead doctors to recommend a sleep evaluation. One of the most common diagnostic tools is a sleep study known as polysomnography. During this test, breathing patterns, oxygen levels, heart rate, and brain activity are monitored while a person sleeps. These measurements help doctors determine how often breathing interruptions occur and how severely oxygen levels drop during the night. In some cases, simplified home sleep tests may also be used. Once sleep apnea is diagnosed, treatment options depend on the severity of the condition. For many individuals, lifestyle changes can significantly improve symptoms. Weight reduction often decreases pressure around the airway and allows breathing passages to remain more open during sleep. Sleeping position also matters. Some people experience more apnea episodes when sleeping on their backs because gravity allows the tongue and throat tissues to collapse backward. Avoiding alcohol before bedtime can also reduce airway relaxation. For moderate or severe sleep apnea, doctors often recommend continuous positive airway pressure therapy, commonly known as CPAP. This device gently delivers air through a mask worn during sleep, keeping the airway open and preventing breathing interruptions. Although the equipment may seem unusual at first, many patients report dramatic improvements in sleep quality and daytime energy once treatment begins. Most importantly, proper treatment can significantly reduce cardiovascular risks associated with sleep apnea. Your body does not stop communicating when you fall asleep. During the night, your breathing, heart rhythm, and oxygen levels continue to reflect your health. Snoring and breathing pauses are not simply nighttime noises. They may be signals that the body is struggling to maintain normal function. Sleep apnea develops quietly. It often progresses for years before being recognized. But the consequences extend far beyond poor sleep. Repeated oxygen deprivation and stress responses place pressure on the heart, blood vessels, and brain. Over time, this hidden strain may increase the risk of high blood pressure, heart rhythm disorders, heart failure, and stroke. The important message is that awareness creates opportunity. Recognizing the warning signs allows people to seek evaluation, receive treatment, and protect their cardiovascular health. Healthy sleep is not a luxury. It is one of the foundations of long-term health. When breathing becomes stable during the night, the body finally receives the rest it needs to repair and restore itself. Listening to these signals and acting early can make a powerful difference for the heart and for overall well-being, because sometimes the most important health messages come not during the day, but during the quiet hours of the night.